Welcome back. Today, we're tackling an absolutely crucial part of human biology, and we're going to make it super easy to understand. We are diving deep into femoral artery anatomy. This explainer is going to give you a crystal clear understanding of the main blood supply to your lower limbs. So let's just get right into it. Have you ever wondered how exactly oxygen-rich blood manages to travel all the way from your heart right down to the tips of your toes? I mean, it's quite the journey, right? Think of your body like a beautifully engineered massive country. To get supplies from the capital all the way down to the southernmost borders, you need a seriously robust, high-speed highway system. Well, today, we're mapping out the major highway of the leg. Here's our roadmap for today. We'll start with the origins of lower limb blood, then officially meet the femoral artery, trace its pathway through the thigh, look at both the superficial and deep arterial branches, and finally, wrap up with some key anatomical takeaways. Okay, first up, the origins of lower limb blood. Let's see exactly where this journey begins.
We're going to trace the arterial blood supply starting from a massive vessel. You probably know it, the abdominal aorta. Right around the level of your fourth lumbar vertebra, which, fun fact, is roughly level with your belly button, this huge aorta basically splits. It bifurcates into the right and left common iliac arteries. Now, these travel down right alongside the psoas major muscle, and the second they hit the sacroiliac joint, they divide again into the internal and external iliac arteries. It's actually that external branch that we really want to keep our eyes on today.
Moving on to our star player. Meet the femoral artery, the absolute major highway of the thigh. So what exactly is the femoral artery? Well, it's a remarkably large artery in your thigh. To put into perspective, it's actually about as thick as your index finger. It serves as the direct continuation of that external iliac artery we just talked about. Its primary day job is providing the main arterial blood supply to the thigh. But it's also a pretty generous provider. It actually sends branches back up to supply the superficial tissues of the pelvis and your anterior abdominal wall. It literally is the critical lifeline for your upper leg. Now here is a fascinating little border crossing analogy for you. That external iliac artery, it doesn't actually change physically. It doesn't magically transform its structure at all. Instead, it just changes its name to the femoral artery the exact moment it passes behind a structure called the inguinal ligament. You can think of the inguinal ligament kind of like a state line. The highway is the exact same road, but the second you cross that line into the thigh territory, the name on the map just changes. Pretty cool, right? All right, let's track the route, the artery's thigh pathway. Here's where things get really interesting. Because this artery doesn't just, drop straight down your leg. It navigates a highly specific spatial journey. Right after passing that inguinal ligament, it travels through the vascular lacuno, which is a little medial compartment just below the ligament, eventually reaching the anterior or front surface of your thigh. From there, it flows down through a channel called the iliopectineal groove, moves right into the anterior femoral groove, and then enters this tunnel-like structure called the adductor canal. Finally, it pops right out of this canal through an opening called the adductor hiatus. It's an incredibly structured pathway. Honestly, it's almost like water perfectly carving a canyon straight through the muscles. Okay, let's talk about the exits off this highway, specifically the superficial arterial branches. To keep this perfectly organized in your mind, we can basically divide these highway exits into two very distinct categories, superficial and deep. Your superficial branches are strictly responsible for the surface tissues. They actually loop back upwards to supply the superficial layers of your pelvis and the front of your abdominal wall. On the flip side, your deep branches plunge inward. They provide vital blood supply to the deep muscular structures of your thigh and, absolutely crucially, the femur bone itself. Let's zoom in on that superficial side first. There are three main superficial exits you really need to remember here. We've got the superficial epigastric artery, the superficial circumflex iliac artery, and the superficial external pudendal artery. Now, I love keeping the mental load as light as possible here, so just memorize these three superficial S branches. If you remember the S, you'll always know exactly which vessels are feeding those surface tissues above the thigh.
Now, diving deeper, here are the deep arterial branches supplying the bone and deep muscle.
Now, this part is super often misunderstood by beginners. A lot of people just assume the main femoral artery directly feeds absolutely everything in the thigh as it passes by. But actually, the main artery acts way more like a transit route. It basically delegates all the local heavy lifting to its deep branches. There are three main deep exits to know: the deep femoral artery, the deep external pudendal artery, and the descending genicular artery. And out of these three, one is vastly more important for the leg's core structures than the others.
Take a look at the deep femoral artery branching right off the main line. It is by far the most prominent deep branch. You can clearly see its major offshoots, particularly the lateral and medial circumflex femoral arteries. By the way, the word circumflex just means to bend around, and that's exactly what they do. They wrap directly around the femur. Why does this actually matter in the real world? Well, these deep branches are absolutely essential. If someone, say, suffers a severe hip fracture, these are the exact vital vessels that are put at risk.
Almost done. Let's quickly hit our key anatomical takeaways to wrap up this journey. So remember that adductor hiatus from our pathway discussion earlier? Well, our highway actually doesn't end there. After the femoral artery exits that hiatus, it reaches the space right behind your knee, which is called the popliteal fossa, and it changes its name one last time to the popliteal artery. But I want you to think about this. How does the body ensure blood flow isn't just completely pinched off when you're sitting with bent knees for hours on end? Well, that complex, highly adaptive network behind the knee is a story for another day. Thank you so much for joining me on this deep dive into femoral artery anatomy. If you found this explainer helpful, make sure to subscribe for more simple, visual medical breakdowns. Catch you in the next one.